Good afternoon, everyone. Thank you for joining us again. Welcome back. I'm Steve,
And I'm Scott.
and together we are Backyard Musings, Apple Valley, California.
The Science and Technology Channel.
And Scott, are we experts?
Absolutely not.
We're not experts. We're just the color commentary. Okay, age-related brain diseases, including stroke, dementia, and late-life depression, can significantly impact quality of life in older adults. However, many of these conditions are preventable. A comprehensive systematic review by researchers at Mass General Brigham. I wonder if that's Mass General Brigham Young. I don't know. Has identified 17 modifiable risk factors that are common to all three conditions. The study shows that addressing even one of these factors can reduce the risk of developing stroke, dementia, and late life depression. These findings, published in the Journal of Neurology, Neurosurgery, and Psychiatry, support the development of new prevention tools such as the Brain Care Score. Would you like to know more?
The researchers systematically searched the scientific literature for previously published meta-analysis of risk factors associated with stroke, dementia, and late life depression. Then they combined these data to identify modifiable risk factors, those that can be altered through behavioral change, shared amongst at least 2 out of 3 diseases. They also estimated that the relative impact of each risk factor on death or on measurements of quality of life and early death. So, yeah, I wouldn't have thought about stroke, but I guess that kind of all goes together, right? Dementia, late life depression, I can understand that, but yeah, throwing stroke in there.
Yeah, so this is probably, again, a product of AI being able to tell it to go search all these databases and pull out the information. So AI, we're finding out that it's really powerful. Okay, quote, our study identified 17 modifiable risk factors shared between stroke, dementia, and or late life depression, emphasizing that there are many different steps individuals can take to lower their risks for these age-related brain diseases, said senior author Sanjula Singh, medical doctor, PhD, and medical science MSc, Axon, principal investigator at the Brain Care Labs at Massachusetts General Hospital, and founding member of the Mass General Brigham healthcare system.
Altogether, the researchers identified 17 risk factors shared by at least 2 of the diseases, including blood pressure, kidney disease, fasting plasma glucose, total cholesterol, alcohol use, diet, hearing loss, pain, physical activity, purpose in life, which I'm not exactly how that would affect it. I guess maybe so. Sleep, smoking, social engagement, and stress. Of these, high blood pressure and severe kidney disease had the biggest impact on the incidence and burden of stroke, dementia, and late life depression. In contrast, physical activity and engagement and leisure activities were the cognitive aspect. Puzzles? Oh.
Yeah, doing puzzles.
Oh, okay. Were associated with a lower risk of disease, though the researchers suspect that these associations may be symptomatic rather than casual, since individuals with brain disease may be less capable of engaging in physical and cognitive leisure activities. Yeah, I don't know.
Very interesting.
Yeah.
So here's another quote. Dementia, stroke, and late life depression are connected and intertwined. So if you develop one of them, there's a substantial chance you may develop another one in the future, said first author Jasper Senth, medical doctor and postdoctoral fellow at the Singh Lab at the Brain Care Labs at MGH. He continues his quote, and because they share these overlapping risk factors, preventative efforts could lead to a reduction in the incidence of more than one of these diseases, which provides an opportunity to simultaneously reduce the burden of age-related brain diseases.
Mass General Brigham researchers developed and validated the Brain Care Score to measure efforts to protect brain health and offer guidance on how to improve it. The researchers have updated the Brain Care Score to reflect the latest scientific updates. They emphasize the need for more studies on modifiable risk factors of late life depression and call for a randomized controlled trial to test an intervention using the brain care score.
So, quote, healthcare is increasingly complex, but these findings remind us that preventing disease can be very simple. Why? Because many of the most common diseases share the same risk factors, said Jonathan Rosend. He's an MD, founder of the Global Brain Care Coalition and the J.P. Kistler Endowed Chair in Neurology at MGH. So I think this brain care score, that's a test. I don't know that you can go online and take the test. I think it's maybe something administered, but I don't know. I should have researched that before doing this segment. So that'd be something interesting to check out.
Well, I'm just glad that they've got people that are still working on this stuff because it's a tough illness, tough disease.
Yeah,
So,
Alzheimer's, dementia, they are tough. Yeah.
yeah,
And it affects,
dealing,
loved ones all around you.
exactly. Yeah. So, yeah, good study. Thank you very much for doing this. So,
All right, folks, thanks for joining us, and we'll catch you in the afternoon.
take care, everyone. Thanks.